problems with the website, well documented. Where do things stand now with the enrollment?
Well, actually, the website is working extremely well, and people are telling me that it takes about 30 minutes from start to finish, particularly if you know what it is that you want to purchase. So we're seeing a lot of people come on the site, go on the Learn side, look at plans available, have conversations with their families and friends, and then come back and walk on through. We hit about 3 million in the middle of January, people who are either enrolled in a private plan in a state-based website or the federal market. And we think we'll have millions more by the end of March 2014 when open enrollment ends. And that will be a very good, solid first-year program.
Obviously, the success of this lies in the ability to attract those young, healthy customers. 40%, I think I saw by one CBO number, is what you would shoot for in that case. How do you convince these young Invincibles to get on board?
Well, I think getting information to them is a key, because people just don't think about it. They might think about, concert tickets or what they're going to shop for online, but they don't think so much about health insurance. We know that their mothers can be very influential, so we're really doing a major campaign, outreach to moms, because it's both about making sure their young adult children have access to preventive care, get checkups and screenings, but also it protects their family from a lifetime of bills if something, God forbid, were to happen. So we know that's effective, and we also know that the insurance companies selling these plans have those folks as a target audience. So we're going to see a lot of mass marketing, a lot of outreach to young and healthy folks. And the good news is most of them will find a plan for under $100 a month. A very affordable health security, and I think that will be a key to getting folks signed up.
Is there a concern what will happen to the premiums if you don't reach the numbers that you're looking for? What might we be looking at next year then?
Well, I think it all depends. It's really hard to speculate. What I was pleased about is a lot of the health insurance CEOs who had a meeting recently with the Wall Street guys talked about the fact that right now they see a pretty healthy market mix, and they think that we're absolutely on the right track. So that's all very good news.
Eric Cantor was talking about promising reforms in 2014. The clutter that is out there, this is the law of the land, the Supreme Court has upheld it, but is that making it harder to convince people this is something you have to do?
Well, I think people are still a little confused. We were hoping that confusion would end when the Supreme Court came down and said the law is constitutional. We hope that the election of the president, the re-election of the president, would settle it. But clearly there's still an ongoing debate, and I think the president was pretty clear in the State of the Union last week. He doesn't want to relitigate 3-4 years of past conversations. If people have strategies to insure more individuals, to make sure that nobody with a pre-existing health condition gets locked out again, to make insurance affordable for lots of folks, bring it on. Let's fix and improve this bill. But in the meantime, what the Republicans announced the other day was actually kind of a recycle of ideas they've been talking about for a long time. Keep people in high-risk pools, get rid of a lot of the subsidies available to make insurance more affordable, not hold insurance companies accountable for health benefits. Those are really tired and concepts that failed, which is why we started out this process with 40 million uninsured Americans and costs that were skyrocketing. We have a great cost story to tell. Never before in decades have insurance costs risen at this low level. We have had Medicare benefits, again, more benefits for seniors, and the slowest cost rise in the history of the Medicare program, which is 50 years. Underlying healthcare costs are down, much to the, that wasn't what the adversary said about the plan. They said costs would skyrocket and we'd be seeing wild inflation. That just has not happened, and I think we're on the right track. We just need to continue.
Millions of Americans tuned in to watch the Super Bowl yesterday, and they saw the president's interview, and a large part of the beginning of it dealt with you. I mean, your reaction when you watch something like that?
Well, let's start from the fact that I don't know that Bill O'Reilly's ever been a big fan, but that isn't the point. The president has asked me to focus on getting the site fixed, which we did, and making sure that outreach and enrollment is successful. And so that's really where we are aimed. This isn't about me, and it's not really about the president. It's about millions of Americans who, for the first time ever in the history of this country, have affordable, available health care. We need to get the word out to them. We need to make sure they know healthcare.gov is working very smoothly. They can call the toll-free hotline at 1-800-318-2596. And between now and the end of March, 8 more weeks, they have an opportunity to really take advantage of health security for themselves and their families, and that's the word we need to get out.
Your father was a great public servant who gave so much to the state long after he was governor. As you go through the difficult times of the last 6-7 months, do you find yourself thinking, what would Dad tell me to do? What would Dad do?
Well, absolutely. He was Jack Gilligan is my dad, a man of enormous courage. He was governor of the state. He was a congressman from the state. But then, as you said, he continued, 25 years after he left the governor's office, he ran for the Cincinnati School Board because he believed in public education. He took on lots of hard battles. And what I learned from him is that it's important to keep fighting. It's important to give voice to a lot of the people who are not at the table, who don't have a voice, and certainly providing affordable health coverage for millions of people who would be sidelined, who would not be able to be productive members of their community or their society or take care of their families. That's a cause worth fighting for, and he was thrilled that I was doing this, and I think he'd be proud that I'm continuing on.